Who aren't as familiar with Patients Like Me, can you tell me exactly what the organization is and what the plan is for patients and doctors?
Sure. So PatientsLikeMe.com is a website. It was launched in about 2006, and it really came from the experience of a family affected by motor neuron disease, as I'd call it, or ALS, as the Americans call it. That's the condition that Stephen Hawking has. It's a unfortunately lethal disease, rapidly progressive, 2 to 5 year survival. And the family really struggled with coping with the symptomatic aspects of Stephen's management. So obviously we're all looking for a cure for many of these conditions, but until then, on a day-to-day basis, patients are living with symptoms like anxiety, constipation, sleep problems, that kind of thing. And because of the way that clinical research works, almost no one's ever going to do a randomized control trial of symptomatic management treatments. So you could take 10 drugs for your sleep disturbances in Parkinson's or ALS or MS, and the problem is it's all trial and error. And so they tried out a lot of things, and what you find sometimes is that the side effects of one drug, that helps you sleep, can make another symptom like the constipation worse.
Right.
So the idea was, well, if we share everything that we've tried, then would that mean that other families don't have to go through that trial and error? So the basis was is that everybody was to share and be open about their data. Then perhaps we could, try and minimize the amount of disruption. So the idea was to take structured questions, so not just free text. We've had for 20 years, Usenet and listservs and BBSs, things like that, of conversations between patients. The idea here was to take structured data, so to take patient-reported outcomes, the same types of questions that we ask in a clinical trial, and to flip those over to the patients. So now they can see them and they can chart their progress on a series of visualizations and graphs. So that's really grown over the last 6 years. We started off in those neurological conditions, and as of about this time last year, anyone with any condition can join the system. And we just surpassed 150,000 patients yesterday. And when you look at the numbers like Facebook, a billion people or something like that, it doesn't sound like a lot. But, just last night we were in the bar and we randomly met someone who's got a family member that's on Patients Like Me, and he had a rare disease, and when he was diagnosed, he said that it was really useful to meet other patients and know that he wasn't the only one. And so for me, when we talk about technology and big healthcare and stuff, we think about the millions. But for me, and what I get out of it, it's those stories. It's the 1s and 2s and 3s. But yes, still, 1 billion people would be great too.
Well, you mentioned research, trial and error. How does this play into Patients Like Me, and can you really use social communities to do research?
Yeah, so that's what the whole mission of what we've been trying to experiment with is to say, if you look at the way that most research is done, you have clinical trials, you have observational studies, you have questionnaires, you have registries. Well, all that tends to rely on what the clinician says, what the doctor says. So in the case of multiple sclerosis, for instance, a relapse is effectively whatever a doctor says is a relapse. There's not many ways for patients to really give their experience. So what we were trying to experiment with was if we take validated questionnaires and we field them over the internet and we try and do some work on data quality to ensure that patients are who they say they are and that the treatments are what they say they are, well, can we actually discover some things? And we started off very small, just with sort of letters to the editor saying things like, oh, did you know this symptom is more common than we thought it was, or stuff like that. And as of now, we have about 23 peer-reviewed publications, and those are in journals, up to Nature Biotechnology, where we did a clinical trial over the internet, or something approaching a clinical trial. So I think we've really tried to be the research credibility core in the Health 2.0 space to say that, look, you have to pay attention to this. This is a new way of doing research, and it can be much faster and much more involving of the patients, because, the other thing that involves is if we want to do a research study with you, we probably have to drag you to the hospital.
Right.
And you might not want to be in the hospital on a Friday morning for 5 hours of tests. If there's a lot of that stuff that you could do at home or on an iPhone or an iPad or whatever, well, why don't we do that? And I think there's a few basic things you could do to validate that the quality of the data is sufficient. But once you've done that, there's no marginal costs in asking one patient or 10,000 patients. So that's really where I think the power comes from.
Okay. And you've recently moved from the US back to your native UK. How do you see there being differences in the two systems of healthcare?
Yeah, so I trained in the UK, obviously, and I'm originally from there, and I moved to Boston for 3 years to head up the R&D team at Patients Like Me. My objective in coming back to the UK was to look at that country possibly as a stepping stone to other countries like the EU, because I feel like with a nationalised healthcare system like the NHS, you have aligned incentives. And when I was in America, I had a tremendous learning curve about, managed care and private healthcare insurance and deductibles and co-pays and all this kind of stuff that many of us in the UK especially don't think about. And we found it hard there to sort of approach potential payers or large hospitals and say, look, we have something that can improve the outcomes of your patients. Would you like to give it a try? They would frequently think in terms of, well, is this going to affect our risk pool? Are we going to attract these expensive patients with rare diseases with expensive drugs? Do we want to really be doing that? Whereas if you look at something like the National Health Service, they have incentives to look after the outcomes of people they treat. So I remember I had a little lump removed from my neck by a dermatologist in America, and he told me that he'd make more money if he made a longer incision, removing a cyst. And so I felt like I kind of needed to get myself away from a healthcare system where that was the measurement. And we're making slow steps in the UK, but eventually I do think that hospitals and doctors and people like that will be evaluated on the outcomes of their patients, whether that's HbA1c or adherence or what have you. What I'm trying to be a voice for in the UK is to say, well, make sure those are outcomes that matter to patients. It's not just days spent in a hospital bed or whatever. It has to be, whatever's important to the patient. Could I get back to work? Right. Can I use my computer without, getting eye pain or whatever? And that's really what we need to focus it around. But I think the UK is going to be an interesting testing ground. If a drug gets approved by NICE, for instance, that's frequently a signal to the rest of the market. So it could be similar there, that the lessons we learn in proving out that patients like me can be an intervention might be able to be applicable to other healthcare systems too.
Okay. And so tell me more about Patients Like Me, your interest in the UK, why the UK, what specifically are you wanting to do there?
So what I would like to do is, when I mentioned Patients Like Me as an intervention, we've published 2 studies, one in 2010 in the Journal of Medical Internet Research called Sharing Health Data Leads to Better Outcomes, and another one in Epilepsy and Behavior about the benefits of an epilepsy community for people with that condition. And in both of those, what we found was when patients self-report, and that's biased, certainly, they reported some improvements that we didn't expect to see. Things like improved medication adherence. We don't actually have an adherence module in Patients Like Me. That's just coming from interaction between patients. Someone with HIV saying, look, I took a drug holiday because I didn't like the side effect, and look at my numbers, they all spiked, so don't do that. And when that advice comes from another patient, it comes in a much more acceptable wrapper than when it's just a doctor or a nurse bashing you on the head saying, take your pills, take your pills. Right. So we saw that adherence thing coming through. The other thing we saw in epilepsy, which was really interesting, was people said that they were using the emergency room less, that they weren't having seizures that required them to go to the emergency room. And that's a mix of, I think, better self-awareness of when they're going to have a seizure, because they can talk to other patients and say, I had deja vu 5 times yesterday. Someone can say, well, that's not normal. You might want to get that checked out. And so these benefits, varied across the spectrum, but the thing that was kind of crazy about it is we decided to look at the relationship between the benefits they saw, things like side effects and symptoms and ER visits, and match that up with how many friends they had on the network, which we got them to self-report, and we also validated that by looking behind the scenes at who they were private messaging. And what we saw, and it's in the paper, is a dose response curve for friendship. So the more friends, the more strong ties you have with other patients that are like you, the more you get out of the system. And the reason why that was so crucial is you'd think epilepsy is pretty common, right? I mean, everyone can say it and spell it at least. Yes. We found that 1 in 3 of our patients who'd had seizures for an average of 20 years had never met anyone else with epilepsy in their entire lives. Wow. And I always think, what we do with maternity when we have, pregnant women all talking to each other, and we bring them into groups and we do coaching.
Groups,
yeah, that's just normal. That's just natural, right? Imagine if you had to raise a child without ever having met anyone else that's mothered a child. It would be very difficult. And yet with patients, we kind of say, well, you know, here's you, and don't talk to anyone else, and your data's locked down and it's private, and don't talk to anyone else in the waiting room.
Right.
And off you go. You know, we'll just shove you out the door. So I think that's been really interesting. But, and here's where the but is, and here's what we're doing in the UK. Me, who made the epilepsy community, saying that the epilepsy community helps people in the subset of people that decided to respond to my survey, is hugely biased. And it's just self-report. And patients saying they think they use the emergency room less, or they think they use their medications better. That's a level of evidence which is suggestive and directional, but it's not going to cut the mustard for me to say clinically, right. Or to say, you know, as a business model, look, we can improve outcomes in your population, pay us to help manage your population. So the NHS is a much better environment in which to test out that an intervention is working. That's like ours, as opposed to the US, where cost is such a big factor. So about 1/3 of Americans avoided going to a healthcare professional visit in 2010 because of costs.
Simply because of the expense, correct.
So for all we know, we could be doing a fantastic job, but if a whole bunch of employer costs rose, or you know the care plan changed in terms of what drugs they could have or whatever, all of that noise could wash out any signal that we had. So at least with the NHS, and it does have plenty of problems, I grant you, it's a more level playing field, and you know someone who's wealthy and someone who's poor have a slightly more equal chance at sort of being at that same level. So if we were to add some better outcomes, hopefully we'd see kind of that rising tide come through. So I'd love to try that out in the UK and maybe do a randomized control trial of friendship on social networks.
Right.
And then we could prescribe that.
Well, and to throw you a little bit of a curveball, but how do you see this relating to participatory medicine?
Yeah, so I mean, the thing that's interesting is the benefits we saw did not come out of any tools that we did. It was patients figuring it out and problem solving with each other, and they were just, you know, responding to each other's needs and supporting information when it was needed. They weren't giving medical advice; they were sharing their experiences, and I think that is a form of medicine. Even more than that, a slightly meta level, I think that healing other people with information is itself healing. You know, people who work in healthcare professions get a lot out of helping other people, and I think that giving that opportunity to patients as well is something that is hugely participatory. Bringing in better knowledge of outcomes and data and the terminology that doctors use also puts patients in a much better level to start asking their own research questions. We have patients in our site right now who are trying to analyze the results of clinical trials even before they've completed the study. So they are educating themselves and using the tools that are out there through things like the open access movement, which makes it easier for patients to read the exact same papers that their doctor can read. So I think it's really an exciting time, and you know, groups like this are part of this ecosystem of this mission that we're trying to get to, of more participatory medicine.
And so what's your hope for the future in a 1-year, 5-year plan?
So I think the 5-year plan is that everything that we're talking about as exciting is normal. It's deadly dull. That you don't need to go and say, oh gosh, I've got an app, or oh, it's on the internet. You know, it would be like saying that you read something in a newspaper that was printed on paper. You know, we don't need to know the methodology. It's just normal. And I think there are a few promising aspects of that we're starting to see around the place. But I want what we're talking about, the medicine 2.0, the health 2.0, just to be medicine. Just to be health management. So that's what I would love to see in 5 years, and hopefully it's groups like this that'll get us there.
Thank you so much for your time.
Great,
everybody.
Thank you.
Paul Wicks. So
Thanks.
Thank you.
And I'm going over here now.
Hello. Well, this is my first plenary in English, so I'm a bit impressed, so I need my paper. Sorry about that, and I hope it will be okay. My name's Yvanie. I was born in Normandy, and I've been living in Paris since about 15 years now. I've been a kidney patient since I was 12, so I knew early in my life that I was possibly that there was a possibility that my kidneys could fail, but I never gave it a second thought until 2001. I was 28, and I learned my kidneys were failing. All of a sudden, I was put on dialysis. Nothing can totally prepare you for such a life-altering event. In hemodialysis, a machine takes the blood from an artery, filters it, and returns to a vein. It's usually done 3 times a week. and each time this takes about 4 to 5 hours to do. So this major change led me to the web for more information. But I was very disappointed. There were a few French sites. It was more than 10 years ago. And they only had statistics and jargon about renal failure. I was looking for the real story of one person's battle with kidney failure, dialysis and transplant, that could give me an idea of what was ahead. I wasn't able to find that in French. So I turned to English language websites. And I found one such site. It was called In Focus, a photojournalist chronicle his journey through kidney disease. John F. Martin was a young journalist who went through end-stage kidney disease 2 years before me. He created a website to publish his story in order to help other patients like him and like me. It was so helpful, inspiring, and empowering to read it. After a few months of dialysis, John's father gave him one of his kidneys. Their whole experience was described with many pictures, their feelings, their hopes, their fears. Everything was so real, so reassuring, and there was a happy ending. Everything went fine. John got his life back, at least for a while. A kidney transplant won't last forever. But when the kidney comes from a living donor, it usually lasts longer. Graft survival is about 20 years. I'm fortunate enough to have a very, very loving mother. So on May 31, 2002, she gave me her left kidney. Everything went fine. We're both going very well. My transplant was a great success. It's going to be 10 years in just a few days. So that's quite an anniversary. We'll definitely celebrate it. And in fact, I'm already celebrating it here at Doctors 2.0 on You. I'll say more about that later. For the last 10 years, I've had a normal life. I take immunosuppressive drugs every day. I have regular medical exams, and I see my doctors just twice a year to check everything is okay. And that's about it. I work, I travel, I'm free, and that's really priceless. I quickly realized how lucky I was, and I decided to try and help other patients, as John F. Martin did. I wrote my story in French, and I asked my mom to do the same. And I created a small and very simple website. I was not an internet professional. I used to work as a financial engineer. I had no knowledge or experience of web development, but I thought it was a good opportunity to learn. Renaloo.com was born on September 2002, just 3 months after my transplant. My goals were to help patients and families better understand what may lie ahead for them on the kidney failure road and to reassure them. It was an immediate success. I received tons of emails from other patients or families saying thank you, asking questions, requesting support. So Renaloo began to grow with more information, medical articles, and a bulletin board. Soon it became a kidney patient community, one of the first of its kind in France, run by patients for patients, and designed to provide timely and accurate information in a supportive environment. A team of volunteers was created. I'm not alone to run the site for quite some time now. A few years later, the site clearly needed to be upgraded, and considering the help provided to patients, the website's traffic and visitor behavior, it seemed to be a good time to become more professional.
Yvanie, got about 20 seconds.
Renaloo became a patient organization, and the new version went live in September 2009. That's the bulletin board. We're also on YouTube, on Twitter, on Facebook. We also have many activities in real life, and we are attached to quality of care and patients' issues well beyond web communication. Thanks to our lobbying, we, for example, impacted changes in the French bioethic laws in 2011 with the extension of the range of potential living donors to unrelated friends and so on, and the authorization of a living donor exchange program. It was forbidden in France. We are now more ambitious. We believe that we can change the world in our own way. We are currently working on a new project, Les États Généraux Durand, could translate like Estate General of the Kidney. For about 18 months, we're going to work with patients, families, doctors, hospital institutions, government, to try and find new ideas and solutions to improve the care and lives of patients and to be more efficient. Renaloo is leading this project, and Web 2.0 is going to play a major role in making it work. With the precious help of Denise and Basil's strategies, a whole new version of Renaloo will be online in just a few days, so stay tuned. I'm more than ever convinced that Web 2.0 is a wonderful tool in patient empowerment and engagement. It's a new and powerful way to improve patient-doctors' relationships and health outcomes. And I'm really thrilled that we were chosen as the cause for Doctors 2.0 on you this year. Thank you.
Thank you.
Hi everyone, I'm Michael Chekroun, and I'm very happy to be with you this morning to introduce you to Carenity. Carenity is the first French social network dedicated to patients. So why Carenity? Actually, I have one of my close relations who suffer from bipolar disease. And I tried to help her to understand why she was having the same drug for 20 years, why she was having this monthly appointment with her psychiatrist for 20 minutes each month. And I was wondering why we could find all this information, but that was not really available or accessible to patients in a proper way. And what I did, not surprisingly, I went to the internet and I came across some great websites, PatientsLikeMe, Inspire.com, Cure Together, which are Anglo-Saxon websites. And I told myself, wow, there are social networks for any kind of subject in the world, but not French-speaking social network able to create links for people in France. So that's the idea, and I decided to start my company a year and a half ago. The website was live in April 2011, so we celebrated our first anniversary a month ago. So Carenity is about providing general information to patients and to close relation to patients, but also providing a social network and a self-monitoring tool. So the first aim of Carenity is to provide common functionalities that are now very common thanks to Facebook or LinkedIn or Twitter. The patient accesses a private section with a wall, with the ability to create a group of friends, the ability to have conversation with other patients in forums. And then the second aim of Carenity is to provide the patient with self-monitoring tool, what we call the patient dashboard, le tableau de bord, which allows the patient to track and follow his health condition along the time, and to have the opportunity as well to share his information with his or her doctor. So Carenity is, like PatientsLikeMe or Inspire, as I said, a real-world data sharing platform. Today, after 1 year, we have around 7,000 active members in 30 patient communities. We have a top 5 of active patient communities, number 1 being diabetes, number 2 being mental health with bipolar disease and depression, and third being multiple sclerosis. What is interesting is to observe what the patient share on Carenity. It's all about treatment efficiency, the side effects, the reason why a patient is compliant or is not compliant to the treatment prescribed by his or her doctor. the patients love sharing their experience about their diagnosis history. Someone this morning talked about the patient journey, and that's something really important to understand the gap between the first symptoms and the time when the patient actually goes to his or her doctor to have the diagnosis. Carenity is about a site collecting information as well on impact of disease on social life, private life, professional life. People love to find and share experience on what the impact of the disease have on their day-to-day life. And as well, they would share information on tips to improve quality of life. So as I said, we developed a data sharing platform. We aim to offer a free service to our patients, but we, as a company, developed an offer to the pharma industry, which is to say, okay, for decades, you talked to the doctors to understand your patient needs. Okay, let's make it the other way around, and let's develop a patient intelligence platform when you can collect real-life patient information. So we developed offers with online surveys, with barometers to analyze the data that we collect through our website, and also a tool that can extract and analyze all the words or the verbatim that are used by the patients. And this amount of information has a tremendous value for the pharma industry to better address patient needs. The pharma industry, as we said this morning, is no longer a drug seller, but also providing services to the patients. And I hope that in the future, platforms like PatientsLikeMe, Carenity, and the next, and the other ones in other countries, will help the healthcare ecosystem to better understand the patient needs. Thank you very much for your attention.
Thank you.
Good morning to everybody. I come from Spain. Sanitas in Spain is an insurance, a health insurance company, is the leader in Spain. And I'm not an e-doctor. I'm not an e-patient yet, fortunately, but I will be sure in the future. And my vision here is a bit different. It comes from the industry. And in Sanitas, we have about 2 million customers in Spain. And we also had a platform of nurses and professionals that were giving support to our customers through the phone. So we had the main assets that we need to convert this in an online community between patients and professionals. And the results of this was Sanitas Responde 2.0, Sanitas Answers. Well, we are a subsidiary of the Bupa Group I have not seen before. This is an online community where we promote that our customers, and in general everybody, can begin conversation or launch questions to our professionals. We began with chronic disease, but now we are working also in the preventive arena. And our nurses and our doctors are committed to answer all these questions and promote conversation in the community. We have also enriched this platform, offering to the users useful health management tools, as we are going to see later, for a specific disease. And, well, we are a private company. We are here to earn money. So we use in this platform a freemium model. This means that it's free because everybody can participate there, can see how are going the conversation, can raise questions or participate in the conversations. But if you are a Sanitas customers, you have added value services. And that's the way we earn money with this through our customers. And we also promote the value of the dynamic services that Sanitas is providing to the whole market. This is the homepage of Sanitas Responde. It's focused on the person. We also know that everybody knows that behind this, there are specific doctors, specific nurses who are attending the consultation that we are having. Reaching this point, I have to address that one of the main challenges that we have faced in this initiative is that the nurses and the professionals working in this project was not necessarily people 2.0, people using social media in an active way. So we have been working with them very closely in order them to get used to these new tools. And as I have said before, we include health management tools to our customers to follow their weight, their glucose levels, the cholesterol, etc. We also have specific services for specific chronic diseases. For example, for diabetics, we run a program of remote monitoring where they have devices to measure the glucose levels that are connected through Bluetooth to our online platform. And the most important thing is that all this information is tracked and followed up by the health coaches that are on the other side. So if your levels are going beyond the normal limits, you receive calls or emails from the nurses, from the coaches, asking you about what is your problem. And we also are connected to the hospitals, to our doctors, in order to have a complete service to our customers. Our professional has a multi-channel role as far as they continue answering questions through the phone, but they are also active in the community, in the online community. And as I have said before, we have premium service for Sanitas customers that makes the difference and make this profitable for us. And well, that's all. Thanks for your attention.
Good morning. So I would like to explain a bit what I'm doing. First, I'm a physician, French physician, but I'm working since almost 8 years in Indonesia, Southeast Asia. And I'm running clinics there, a branch of, we have 4 clinics, more in the aesthetic business. Recently, we have created a media social platform, and the name is BlaBla Doctor. Why this name? Because I was thinking people like to speak about their health, and they want speaking a bit like a doctor. So I find this name a bit catchy, so we have developed this platform with this name. So we are in Indonesia. So Indonesia is a larger Muslim country in the world. There is 240 million people. Internet user is 55 million now. If we go to 175 million in 3 years. And is the second largest user of Facebook and the third of Twitter. So social media, general social media is quite very common in Indonesia. Also mobile social media. But about concerning health, it's true that the image of Indonesia is not so good, because the hospital industry is not so developed, and the doctors are very powerful there. So the idea of this platform is to give the free expression to the people, not only the patient, but also people who are interested by health. It can be for the family, because in this kind of developing country, most of the time the young generation helping the old generation. So I believe it should be something a bit open, and is the main idea of this website is to be to answer to the needs of the people of this developing country. So on the left is a bit explanation about the internet user in Indonesia, but most important is about this incident who appears in 2009. It's a story of a lady, you can see here. She went to an hospital, quite a nice hospital. She's from the middle class, and she complaining about the treatment she have received in this hospital on some emails. And The hospital was aware about this complaint by emails, so they started to sue her, and they put her in jail. She gets 6 years jail and $100,000 of penalty. So this case was a bit scandal, because in the end there is a kind of Facebook community starting to helping her to pay the amount of the money, and to challenging the government to let her going out. So finally she went out after 3 weeks, and this case became very popular. It showed that there is a balance between the powerful healthcare system, private, and the small people. So my idea in my social media is to be concerned about this topic. So I have integrated the hospital in the platform. I will show you the page. So it's not a fan page, meaning because on Facebook we see a lot of fan page about hospital. What I like is people can join any page of any hospital of Indonesia. There's more than 6,000 hospitals in Indonesia. So people can become member. The good idea is they can meet people using the same hospital. They can become friends. They can give also comments and critics. And also you see on the side, there is like a widget, or the people can give review, some kind of star, if there was patient, if there was visitor, what kind of service. So the idea is to get data from people, because I believe other people can be interested to get this data. The idea is not to critique hospital, say, oh, an hospital is very bad. Every hospital are good, but it's just to moderate the quality of some hospital, and maybe try to make them understand they need to improve in some way. So all these data are not showing in public. They are compiled, and step by step we release the data for each hospital. Other part of the website is a classic social media. It looks like a Facebook because people like Facebook, so I make something like Facebook, just the color is green. But I develop like a bit like a patient like me, but it's more people like me, so people can find other people having the same center of interest, same disease, or same treatment, or same past surgery. It makes people easy to mingle each other. Also, we have a big part of the platform is about drugs. We can present the brand names and so the generic drugs. Why is it important to speak about drugs? Because in Indonesia, there is a 20% of fake drugs or expired drugs. So it's possible for the people to give alerts. So there is a case of an alert here. It shows that there is expired drugs around an hospital in this area of Jakarta. So this kind of platform is really helping for such a country like Indonesia, because I believe people have more needs maybe than in some developing country like in Europe. We have many contents about some very, very sad story of people cannot afford to pay some drugs or see the doctor. So with this kind of website, I think they are a bit helping. Thank you.
Thank you.
Yes. I'm happy and pleased indeed that I can show Drimpy to you. Probably the most easiest and most usable healthcare platform for any patient to track and trace his own health experiences, his medical information and data, and truly engage and interact with that with his healthcare providers, his loved ones, and other patients. I use screenshots, so it is not dynamically, but you can easily register yourself on drimpy.com and look how it works for you. What you see in my pages directly is the main features depicting the journal of my health experiences, regularly scored by myself, my medical record with all the data, and my networks that I can use to talk with and interact with in complete privacy. And that is the basic principle of Drimpy, facilitating actually participatory care. And that means it is about private and convened interaction without intervening by others, and it is also by shared decision making. So trust is the very basic of Drimpy. Over to my medical record. You see that we have designed it in specific modules, formats, so as to easily cooperate with other programs and work together to design the caring tools for the patients. On the top of that, you see the medical documents, either uploaded by myself or shared to me by my health professionals. The story of my conditions that I have now or that I have had in the past. So any new healthcare professional or other patients that I select to in my patients can inspect that and talk with me about it. My allergy and specific my medication database, possibly supplementary nutrition or medical instruments that I use and want to keep track of. And we are going to add a button here based on our implementation history that signifies a button for professionals that want to acknowledge that they know that the patient is using that specific drug. So synchronizing in a way there's two separate databases for the doctor and the patients and the list of caregivers, etc. Over to a demonstration of how Drimpy will help you auto-completing what you are writing. So you use specific terms in medical terms. And over to my journal that depicts the standard parameters that I can use in the free version on the net. Complaints, blood pressure, heart rhythm, etc. And specifically registrations of daily mood, 5-point scale, pain sensations, 10-point scales. And in the right-hand corner, which is now blank, there is the room for specific applications made by health departments, hospitals, or GP practices that want to specifically have their individualized application for a certain condition. So a patient can push the button and the parameters that he is expected to track and trace in his journal is opening up for him. Also, all applications for instance, prescription compliance, education and information applications can be sorted here. And it may look in practice like that. There is the graph feature that makes it possible to inspect my history of how the parameters are evolving, can share it, print it with my healthcare professionals and my loved ones. Of course, doctors can set upper levels and lower levels to depict the area of allowance for a certain parameter, and most of all can individualize the therapy depending on the parameter that is found at the beginning of the therapy. Then to the core of it all, and that is my interaction with specific persons that I have selected in my networks. At the left hand, you see my private networks, my loved ones, other patients, etc. So working with patients like me, I can introduce patients that I found that want to help me into my private area and say, look at this, look at our parameters, share my data without being intervened by public interventions, etc. And on the right-hand side, the time is up. Right-hand side, my medical network that allows me to pick directly the professionals that I want to talk with. Here is a sort of wall that depicts all the things that happen on my pages and the interactions and more. As you can see it on the tab, the message line, that is the private interactions between me and my healthcare providers or others in discussing and interacting in private what is going on. So there is no need for physical face-to-face consults. I can do it online based on the trust of those that I have specifically selected to work with me. Then the last frame, and that depicts the professional's perspective. It is the dashboard for a professional that can show all the patients in Drimpy that are working with him. And of course, that view can be formatted so as to bring forward, for instance, all those patients that have an alert, all those patients that suffer from a certain condition, and at the left-hand side you can see the filter instrument that can show patients with a certain disease, with a certain medication, etc. And this is all private information, and that is also for gathering the data. We for Drimpy say we should study the data from private caring of patients in a way that they consent with the assemblance of that data. So it is not automatically used as we have seen other websites doing that. patients will explicitly be asked whether they want to join a certain research with their data, yes or no, as it is in physical circumstances as well. So Drimpy is really about caring together, facilitating participatory care, and working together and facilitating actual doctors and multidisciplines to work together on Drimpy with the data of the patient, because if they are on Drimpy too, they can interconnect through the networks. It is about the balance between medical, patient, and business values that are very intrinsic to facilitating care, and leveraging and making room for learning of the parties to get together in a more intimate and concrete way. Thank you very much.
Thank you.